benefit not just to us, but also to the organization and to the economy at large. For example, for the patients, there are going to be better patient care. Nurses are going to work efficiently. When the nurses are being cared for, there's going to be a reduced turnover. What I mean by reduced turnover is people who come to the hospital probably this month to treat a certain ailment, they don't have to come next month for the same ailment or next week for the same ailment. When the nurses, the healthcare profession is also being taken well care of, I think there's going to be a lot of improvement. There's going to be a lot of reduced malpractice if these things are being also looked at. There's going to be increased productivity. Nurses are going to work efficiently and effectively. There's going to be reduced burnout for the nurses, because most of our healthcare system, you go to hospitals, you see one nurse to 15 patients, taking care of 15 patients, and the run is quite a long one, and then it causes burnout, causes some emotional turmoil for us. We're unable to care for even ourselves, or even have time for ourselves because of the burnout we face at work. There's going to be an increased staff morale for us when we are being taken care of. Our salaries are being are increased, or we earn well. We are able to take care of ourselves. We're able to work. When you come to the hospital and you see nurses working all around, you know that these nurses are being taken care of. Yes. The hospital also, there'll be enhanced reputation for them, because if you have a particular hospital that their staff, like the nurses, are efficient enough, people would want to go to that hospital to receive better health care. And there'll also be increased job satisfaction, not just for us also, but for the hospital at large, because they'll be satisfied that the nurses are working very well. So I believe that we have a lot of challenges facing the nurses, and if they're being looked into, the working as a nurse in Nigeria will be better than it is right now.
So
it's a service to university, a service to the economy, and the passion is what drives us sometimes.
Okay, but so you've talked a whole lot about the challenges that you guys face, short staff, monetary, long hours of work, fatigue, all those things. But are there any highs? Because I'm curious, do you guys enjoy anything about being nurses in Nigeria as it is right now? Is there anything whatsoever that we can look and say, well, this is the benefit, or these are the highs, these are some of the things that nurses are enjoying?
Well, for me, the reason why I went into nursing was because while I was a teenager, one of my love languages is act of service, and I love helping people, especially in the vulnerable moments. And I think it was when my dad was sick, and I was able to help, nurse him back to good health. And the satisfaction he got, the happiness in his face, whenever anybody comes and say, "Oh, you're looking so good," it's my daughter. Or it really brought so much fulfillment to me, and I was like, oh, okay, that's passion for me. And this is one of the highs of being a nurse, when you're able to see people who you've taken care of in their times of vulnerability come back to health, in good health. Yeah, I think that's one of the highs. And the prayers that they pray for you, I can tell that a lot of prayers are working because of the people, or a lot of things are working in my life because of the prayers I've gotten from the patient relatives, or even the patient themselves that I've taken care of over the years.
Yeah,
and it's amazing.
So that's it. So let me ask you, what inspired you? What was your inspiration to become a nurse in the first place? Was it something you saw as a child?
Like I said, it was the fact that I could see the happiness in people's faces, especially when you take care of them. I could see the when you look at people who are vulnerable, people who are sick, you see that lack of hopelessness. You see the hopelessness in their face. And when you take care of them, you see that, breath of fresh air. You see them very happy and full of life back. Yeah, I think that was what I saw, and I was like, oh, okay, is there anything that I could do professionally to have all of these skills and practice professionally? And then I was told, oh, okay, nursing is a course, and I could read it, and I had to pursue my.
All right, so let me ask you, nurse, how do you manage your challenges or stress during difficult shifts or emergencies? Because I know with what you talked about being understaffed or, short staffed in some instances, there's a lot of stress and fatigue that comes in for you as a person alongside your colleagues, right? How do you guys manage that? How do you unwind?
Oh, well, we have to prioritize care. We understand that without us, some of the patients are not going to get well. So we try as much as possible to make our time for ourselves. We practice meditative sessions, yoga, anything, stretches, exercises. We also talk to support system. Most of us have therapists or loved ones that we talk to, talk about our challenges, talk about the stress, of the work in general. So there are a lot of activities that we do to unwind. For me, I attend yoga classes, I attend music classes, I go to the gym, just to help release all of those negative auras and energies and everything and the stress in the work. Yeah, wow. Basically.
Okay. So let's talk about also, the role of nurses in improving healthcare. I mean, of recent, or not just say recently, Nigeria has seen a lot of deterioration in terms of healthcare over the years, with a lot of cases of, what do you call it now? Medical personnel like nurses, doctors, lab technicians, other people within the field having to leave the country maybe because of no motivation, lack of good compensation, adequate. And right now we're faced with a lot of dangers or gaps in the Nigerian healthcare. What roles do you think the nurse can play in ensuring that we have better healthcare in Nigeria? Do you actually feel the nurses have a role to play in that in the first place? And then if you feel it is like yes, then what could be those roles that you could play as nurses?
Yeah, absolutely. The nurses have roles to play in improving the healthcare system by joining hands with the top government to bring out policies that would help improve the nurses' retention, salaries, and all that, their welfare. So I think that's one of it. Secondly is to create campaigns to help each and every one of us nurses to see how well we can help each other in different areas, especially in workshops, just to improve our knowledge and our skills in the field. I feel like these are the two major, to see where, because when nurses are being included in decision making or policy making, this will help the government come into the field and know where to help us. And it can also help with the challenges that we are facing currently.
Okay, that's interesting. Okay, so there is this impression, okay, about Nigerian nurses, and I want to know how you deal with that. Sometimes when you talk about nurses, a lot of people always have this negative impression. Nurses are this, they're harsh, they're not even friendly. They are used to seeing people, in a very bad state, so they don't care. Nigerian nurses have lost their empathy for people and stuff like that. How does that make you feel? And in the real sense, do you think there is room for improvement in terms of the profession? Because when you talk to say, long ago, nurses used to wear white, they were a symbol of peace, but now you see nurses being very grouchy, they're unfriendly, and, a lot of terms used. How does that make you feel? And then basically what you have to say moving forward and stuff like that.
I mean, this is my profession and I really love my profession, and it makes me whenever I hear people talk ill about the profession. It still boils down to the organization that you're working in. I've gone to hospitals. I have been admitted also at the hospital, and there are places I go to and the nurses are really, really friendly. And there are other places that you go to and you see that these nurses are, they don't have empathy. First of all, we have a lot of quacks currently that parade themselves as nurses, and they do not understand some of these skills of a nurse, especially one, empathy, understanding, active listening, care, observation. All of these things are skills that are taught in school and not just at the hospital. So the quacks parade themselves, and they're the ones who give that narrative for other people to run along with them. Second, like I said, when there are adequate staff in the hospital, okay, the nurses will work efficiently. I
Mm.
mean, you go to a hospital and you see one nurse managing 15 to 20 patients. And you know what it means to manage people who are not really well? You know,
Mm.
they need constant attention and everything. The nurse
Yeah.
will definitely be burnt out.
Mm.
She also
Mm.
she's a human being, yeah. So she's going to be stressed and all. So sometimes it can also tell on it. And there's something the nurses, that most nurses do that are not really ideal, especially because everybody, life is happening to everybody. But one thing I do is when I come to the hospital, I drop all of my problems at the gate.
Mm.
That way, my problems do not interfere with the care I render to my patient. I do not have to transfer aggression, or I do not have to, you know, I work in a mental health hospital. And so these people, you need to be happy for them to be happy. You know, you need to have this positive energy for them to get infected with it. So if you are aggressive, if you are not a smiling nurse, it will also affect them too. So I think we encourage that nurses also practice most of these skills:
Mm.
empathy, observation, communication, you know, listening skills, therapeutic relationship, just to help foster relationship between patients, you know,
Wow.
and reduce the stigma and all of the negative reviews about the
No,
profession.
seriously, Nurse Akila, is it possible to maintain a happy disposition and a sort of comportment all through your day, especially when one of them annoys you? I mean, for your own field now, you're a mental health nurse, and we know how the peculiarities of that field is. Is it really possible that you maintain that sort of the things you're saying in a whole day?
Yes, nursing is an art, honestly. And in my field, is one thing I understand. These people that I'm taking care of, they are in
Yeah.
another world. I
Mm.
mean, they're not in the world of your own. And so they, most of the time, do not have the insights that you have. So they do things out of impulse, they do things without thinking, and they're going to definitely get on your nerves. So why would you, you know, get angry, or why would you react to a patient's tantrums or insults when you know they clearly do not know what they are doing? So honestly, I wouldn't lie, but I'm reminded every day the reason why I'm in this profession and why I'm here is to help people like this, and one of the challenges we face. And so you shouldn't take it to heart.
Okay. Thank you so much. Let's quickly take a commercial. Then we'll just come back and round up this and I'll let you off because I know you have a lot to do, please. So just stay with me. I'll be back.
You to the 5th Abuja SME Expo with the theme Access.
Hi everyone, my name is Swat. That's the name my father gave me, but you can always call me Her Vocal Majesty. I'm the host of The Sunny Side on 95.1 Nigeria Info. It takes place every weekday, noon to 3 p.m., where we get to have all the lovely contemporary conversations. If your days are normally long and gloomy, well, not anymore, because I'm here to make it all bright and sunny for you. So join me. It's an invitation. You don't want to miss out.
science, especially when.
Hello? Hello?
Yeah, sorry, I'm with you.
Okay.
You're able to tell who a quack is by their mannerism, and especially when it comes to deep nursing questions or according to or questions about the prognosis of your health condition. So when you ask a quack, they don't even know what to tell you. They just tell you, oh, this is what the doctor asked me to give you. This is what they say I should come and prescribe, or this is what they asked me to come and administer. But when you see a qualified nurse, she's able to explain in details the procedures for your treatment and while you're on certain medication, and also provide health education for you for further prevention and promotion.
Okay, that's interesting. So, are we supposed to ask them for their numbers, or what are we? How do we? Because some of us, like me, if I go, I love to ask a lot of questions. I mean, so what are some of the ways? Do we ask for their nurse? Is there a number you guys have, like lawyers have their Supreme Court, numbers that they give to them, their seal and all of that? Is there anything in particular apart from, just being under the registered as a nurse?
Just with your license, I think that's just the license.
Okay, the
we
license.
Don't have numbers that can be identified with. Yes.
Okay.
You could just ask, are you a qualified, are you a registered nurse under the Nursing and Midwifery Council? And she's going to answer diligently, and that's it.
Interesting. Okay.
Yeah.
So moving forward, right? What would you like to see happen to help the nursing profession in Nigeria to go a notch higher and be at par with other parts of the world that are actually practicing it to a level that I'm sure many of you guys admire and would want to see it replicated in Nigeria? What do you think the government can do? What do you think the midwifery council and generally everybody within the profession, what can be done to help the nursing profession live up to its billing and expectations?
Okay. One of the most important things I think that can be done to help improve the nursing profession is to totally eliminate quackery in Nigeria, and then to put important people in the policy decision or in the decision-making process alongside other government officials. That way, our challenges as nurses can be put together and looked into, so that the nursing profession can be upgraded. First of all, eliminate quackery. That way, it gives more room for nurses to be employed. And then when there are adequate decision-making or policy makers in the system, we are able to tailor down our challenges like poor infrastructure, inadequate resources, the work environment, the poor staffing, the salaries, the working condition. When all of these challenges can be put up and decision makings can be carried out, and I think the nursing profession can also improve. And you see that there will be less Japan from the profession.
Yeah. Talking about jackpotting, I hope we hope to hold you guys down. I hope you don't have any plans of jackpotting anytime soon. Because some of my nurses friends, when I ask them, they're like, just wait for opportunity to come first. Then you now ask me that question. I'm like, we need you guys, honestly, because you guys contribute a whole lot. So, and I know how this syndrome has really affected, especially our public hospitals, that you go and see thousands of people waiting to be seen by maybe some few medical personnel, and it all contributes to the problem that we're having. Thank you so much, Nurse Akila. I think I have a couple of messages here. Let me just read them out. Good afternoon, SWAT. Greetings and to all Nigerian nurses as they celebrate their week. Please, I fervently beg all the nurses to never grow beyond empathy because of the frequency of many ailments. Many patients see them as angels, and their looks and pampers go a long way to ameliorate their suffering. So that's Mr. Banky there. Fidelis the painter said, listening from Abuja Airport, I'm really learning from the nurse as she's really educating us. Thank you, Ma. And may God continue to give you more knowledge. I say thank you. Amen. I vowed never to lay my hands on a woman, but the day a lady in my former compound insulted a mother. Okay, that's not for me, I guess. All right, so I guess those are some of the messages. I mean, is there any message you would want to give out to your fellow nurses, to Nigerians before I let you go? nurse?
Oh, yes. To my fellow Nigerian nurses and all over the world and even in Nigeria, I just want to appreciate us, even though the world does not really appreciate us enough for the service that we render to humanity. But I know that most of us are in this profession for passion. And we pray that God will continue to give us the strength and the opportunity to keep serving humanity and repay us for all our kind deeds.
Indeed. Thank you so much.
International Nurses Week.
Yes. Happy International
Thank you.
Nurses Week. Thank you so much. I've been speaking with Nurse Akila Ngoye, who is a registered nurse and a certified registered mental health nurse. Thank you so much, nurse. Enjoy the rest of your day.
Thank you.
Okay.
Thank you too. Bye.
Bye. Yes, that was Nurse Akila there, graciously talking to us about the International Nurses Week, which is ending today. Started on the 6th of May, and it's an opportunity to, talk about your nurse. And on this platform, we have one nurse that is quite popular, and, let's talk with her. Hello.
Hello, Swat. Good afternoon.
Good afternoon to you. Happy International Nurses Week.
I'll be quite busy. I truly appreciate the show to your station, and I also appreciate my colleagues who work in the same place. I'm a registered nurse and also a mental health nurse.
Wow.
You talked about, I just want to clarify some things,
Yes.
addition to what Dr. Kuka has said.
Yeah.
She talked about identification. Sorry, I'm on the road. Because of the quackery, the facts that we have,
Yes.
we everybody have our life and our license number, just like the way doctors do. When you meet a doctor, he just tells you his number. The same people here are not used to that, but we are just. And when you say we bring it, then we show you. We have a lot of facts right now that I thank God for some states that are trying to, fish them out and then top them. And so I would also commend maybe the FCT to start doing that. When you go to the hospital, you just ask, "Oh, can I know your license number?" You can just say it, and you say it. When you just go in the Nursing and Midwifery Council of Nigeria, you'll see that person is being registered. Because a lot of what is happening right now using facts and the likes of them. They just go for 2-3 months, what's it called, experience, and before you know, they start taking patient without knowing the anatomy of that individual.
Yeah.
So that's just it. I truly appreciate you for coming in to speak, and Swat, thank you too for the opportunity given to us to be celebrated here. And to all the nurses worldwide, I want to say Happy International Nurses Week.
Thank you. Thank you so much. Thank you. That's our own very Amaka. She's a big member of this family, and of course, she's a registered nurse as well. International Nurses Week is something that is worth celebrating. Nurses ought to be celebrated, and you heard it there. It's not every nurse you see that is a registered nurse. So, as the quacks that they are, you begin to spot some particular things. It's just like when you meet a lawyer, a doctor, an engineer, an architect that is a quack or is posing as one when they are not. Once you meet a professional, there are some certain standard. It doesn't mean that, of course, they don't have their own flaws here and there. But definitely, you would understand with the way they treat you, the terms they use, the care they exhibit when they are treating you or when they're handling professional issues brought before them. So it's very advisable, especially when you meet the ones that are always shouting at the top of their voice. Or, the last time I was admitted in a hospital, I remember an incident that really got me, I don't know. Now, this lady she just could not even, number one, put in that thing that would make the drip go in. I don't know what they call it. There's a name for it, basically. She kept on, putting it in and bringing it out. Eventually, when it got in, the blood started, what do you call it now, clotting, or it got, the vein became really very, the drip was not even going in again. And it was so painful, freaking painful. And somehow they had to go get another person who came and did it. So there are some things that you just notice in the way they carry on with the work. So it's pertinent because your life is at stake. Your life is at stake here. If you don't ask questions, if you don't push to know who is treating you or who is over your case, well, you only have one life to live. They can most probably arrest the nurse, but maybe your life would have been gone. So that's why it's important. I know in Nigeria, most of the time, we're always scared to ask questions and to push to know, but it's very, very important. So if you have anything to say to nurses or anything you have to contribute on the conversation this afternoon with regards to the International Nurses Week, which ends today, let's have the conversation. I mean, what's your experiences with nurses? What do you have to say to nurses? And we're talking also about saying positive things about them, honoring them for the work they do, acknowledging that they contribute, and what more can also be done with regards to the issue of nurses in Nigeria. So let's know what your take is on nurses. You want to talk about nurses? You want to talk about their contribution, your experiences? Please share with me this afternoon on 0700 951 0000 and 080 9597 4869. Hello.
Hello. Good afternoon.
Good afternoon to you.
Yes, my name is Mohammed. Please, there's one question that I want to ask you. If you can go off air, please.
If I can go off air?
Yes, just 2 minutes.
No, I can't go off air now, sir. I'm on air, so you can send me a WhatsApp message.
Yeah, I'm a visual impaired, so the phone that I'm using all this potent phones.
I'm sorry, I can't do that now. I am on air, and it's not allowed that I go off air.
Okay, so it's one jingle that you played. There's one advertisement that you played the other day, that's last week, that if people want to apply for application.
Sir, I don't know about that. I'm not the advertiser. That's why you people listen and you take down the details. I'm not here. I don't represent them. So anybody calling to ask for numbers of clients, I really don't have, honestly. It's not in my place.
No problem, no problem.
Thank you so much.
People play the jingle again.
All right.
No
Thank you so much. Hello?
Can I some coins?
No, I don't.
Yeah, I'm very familiar with the topic and why the lady nurse was saying, because
all right, sir, can you introduce yourself, please, before you continue?
Can you hear me?
Yes, can you introduce yourself before you go on?
Oh, my name is Uncle Tom.
Okay.
Uncle Tom, I'm calling from Ube.
All right.
I say I'm very familiar with what the lady nurse was saying, because my wife just retired matron.
Okay.
She did midwifery, then she did general nursing, then that's what you call double qualification. Incidentally, in my teacher's training too, we did what we call health education. That is whatever is taught in the nurse school or nursing, we are taught in the teacher's schools. That is during our time. So you are talking about registration. Yes, when we were in Kaduna, I used to, because their certificate, you have to renew, they keep renewing it like driving license. So when we were in Kaduna, I used to go to Lagos and do the registration for her, because it does expire. And then talking about poultry, there are more poultry nurses than the original one, really. And they are the ones that are causing a lot of problems, because the hospital management, they want cheap staff. And to the extent that these poultry nurses, they give injection. Oh my God, it's terrible, it's not good. Nursing profession, you see, they are very much wanted. Like my wife now, because of this, she would have been working in America now, because few of her mates that retired, they have gotten job in Chicago, in US. So it's a very, very noble profession, and the rest of them, particularly those of them that suffer so much are the ones that did midwifery. It's not every nurse that has what you call double qualification. That is, some just did general nursing and go to do their master's MSc nursing. But she did, first of all, did midwifery and then did general nursing. So I'm very familiar with the career. She spoke very well. She's so sound.
All right.
Now the points, eh?
Thank you so much, Uncle Tom. I don't have coins.
No, wait. Do you have some coins?
I don't have coins.
Please let me send you account number. I beg.
Thank you, Uncle Tom. Abdusalam Salisu, thank you. I see your message. Good afternoon.
Yeah, good afternoon, Madam Swat.
Good afternoon to you. Welcome.
Thank you. Yes, my name is Doji Chris. Swat, well, it's unfortunate that the nurse has, gone because I have some questions. And to start with, I just want to wish all the nurses out there happy International Nurse Day. I'm sure that the good ones are really doing the job. Even from the injection that some of these nurses are giving you, their patients, you will really know if some of them have what it takes to be a nurse. Is it passion, or let me just get something and then go out of it? But sure, when she made mention of that, some of these hospitals, they doesn't want to pay, they doesn't want to pay well, and then they will now recruit some of these nurses and train them, 2 or 3 months and employ them into their system. If government finds out that a hospital is doing that, is that not a way to punish such hospital? Because it's unusual that a hospital will even collaborate in doing this kind of a thing. You have not had to answer that question. And again, sometimes when you go to hospitals, when most especially see women want to put to bed, you don't see the way nurses are shouting to them, madam, waka like this, now see the way you waka, and I need to give you the law. No, there is law that is happening that the nurses, the training needs to be consistent. Thank you, Swat.
All right. Thank you so much. Well, like you rightly asked, I think that is a basis, but I don't know what they are doing about that, right? The Nursing and Midwifery Council also have a responsibility to collaborate with other government agencies. It's an workability kind of thing that can be done to fish out not just the hospitals, but also the ones, But, before some of these hospitals employ, they have the due diligence, or they need to do their due diligence by asking for all that is necessary and the confirmation. But how many of them do that? Many of them are trying to save money because they see it more of a business. Okay, there is a business aspect of it. But first of all, it should be about taking care of people, attending to the needs of healthcare and ensuring that that is properly covered. You're solving problems when it comes to that. And invariably, the money would come to you or will come as a reward, right? But we don't get to see so much of that happening and all. But I hope we keep getting better and better. We hope to see Nigeria rise to the level where health tourism is going to be a thing. That people from all across the world want to come to Nigeria to come and get healthcare because we have some of the best nurses, some of the best doctors, some of the best, machines or infrastructures that are needed to ensure that proper healthcare is actually put in its rightful place. That's my hope. And we hope we get there with right leadership. Okay. Why is the nursing profession a woman-dominated profession? And anywhere you find plenty of women, definitely there will be issues. I find that very insulting, Mr. Joe. Why do you say issues? So my question is, how do they handle unprofessional and erring nurses, especially how they talk and behave in character? I don't know. You saying when you find plenty of women, there is issues. In fact, cancels anything you have to say, because I think that's very insultive to women. Basically, I don't know what you mean that there should be issues. And then how do they handle that? I don't know. I'll just choose to ignore your message. Zach from Kuchikau said, good afternoon, Swat. Have Vocal Majesty. Happy International Nurses Day to all the nurses. Please, why is it that as parents, we pay heavily to sponsor our brothers and sisters to study the nursing profession? My younger sister is presently studying midwifery. Is it midwifery or midwifery? I hear people call it different way. Anyways, don't mind me. I'm just kidding about that. But we are paying from our nurses, or we are paying from our nurses to meet up with the demand of the course. After graduation, she will now come and be collecting peanuts monthly. Okay, so you are asking about, how peanuts their pay is, right? Well, I get to hear that, and like Nurse Akila also talked about, one of the factors is because you have some quacks, so you just want to employ them and pay them peanuts. But I think the certified nurses, really, really, if you're employing them, you have to pay them well, because the nursing profession in some parts of the world, that's one of the best paying profession. They really, really get to pay them well because they put in a whole lot. They're putting a whole lot to ensure that things and the healthcare system is not without, or is without those gaps that we would have to pay dearly for in the absence of nurses. So, yeah. I guess your sister, since she's really going through the right route, that is actually going to school and getting certified under the right situation and circumstance, I'm sure that should not be your problem, okay? I'm sure she'll get herself a good job and she'll get to be paid well. But even though we can do so much more, I mean, because in Nigeria, with the economic situation, I mean, people would always want to ask for more in terms of pay, and the institutions can also do so much better by paying so much more. Okay, it's the International Nurses Week that we are celebrating as we have a conversation. We will begin to round up now. It's 1:51, and at 2 o'clock, we'll be switching over to look at some international stories, and then we'll be having a guest at 2:45. So you can call 0700-951-0000 and 08095974869. WhatsApp, where you can record a voice note or send a message, is 080-999-30137. All right. Good afternoon, Swat. I celebrate with all the nurses, especially my mom, who is hardworking nurse at Eden Island in Seychelles Republic. Swat, you can imagine the world without nurse. Do you know that nurses are paid more than doctors in Seychelles Republic? This is to tell you how they value nurses in that country. Happy World Nursing Day or International Nurses Week. That's interesting. Obedient man Emeka sends that in. Oh, so your mom is a nurse. Okay. You find people who have a soft spot for nurses based on the fact that maybe their mom or wives or something like that is within that profession. But it's a good one. And we, like I was saying earlier on, I hope we rise to the responsibility that we owe the nurses to pay them well and create a more conducive environment for them to work and be more pleasant, and also exert their professionalism to help people who are in need of that. So, having said that, thank you guys for contributing on this very segment where we have celebrated the nurses. It ends today, but the conversation still continues. I mean, if there are issues as they arise from time to time, we get to bring them here. But I'll draw the curtain for this segment and we'll take a break. Then I'll be right back to take up the next segment, which will be the exchange. Please don't go anywhere.
Stay one step ahead with Nigeria Info.
From the biggest stories,
Trends and conversations.
let's talk
Only
on Nigeria Info. We are in a time where people yearn for information.
information is quick. The larger the reach, the better.
Bits
Pieces.
and the whole. All the details right here on Nigeria Info.
Let's Nigeria Info.
The hub for information.
Current affairs and more.
The president used his last Democracy Day address to talk about several issues, including security.
It is this same government that they started it. They don't obey court order.
Join the conversation.
Right here.
Let's talk.
It's like ER.
With information comes power.
We give you more power with information.
I'm tired.
95.1 Nigeria Info.
Let's talk.
I am sick.
More conversation, more talk, more right after this.
Welcome back to your number one talk, news, and sports station. This is Nigeria Info.
Nigeria Info.
Of compassion. I wasn't always like this. When I started my nurse training at the age of 17, I didn't think much about compassion at all. I thought about resuscitation and saving lives and cracking chests. I thought a lot about television programs like ER, and I thought a great deal about George Clooney. But nursing taught me pretty quickly that saving lives is about a lot more than cracking chests. In 2018, I left the nursing register, and I am a writer and professor of medical and health humanities. And my research over the last few years has been about compassion and empathy and kindness and what it means to be human. And central to the idea of all my work is that compassion is the most important thing of all. And yet, I realized that during my years as a hospital nurse, particularly in intensive care, I felt a bit burnt out, apathetic, and sometimes even indifferent to extreme suffering. I was experiencing compassion fatigue. Pain and trauma, like viruses, can be extremely infectious, and nurses and other healthcare workers, they swallow suffering every single day. Indeed, the word compassion comes from Latin compassione, which means to suffer with, suffering together. And there's only so long you can do that for, if you do it right, without becoming a little bit numb. I felt a bit numb. And then came the pandemic. I remember being on a flight once, coming back from Kenya, and there was an announcement on the tannoy. Is there a doctor or nurse on board the plane? I looked around, nothing. And then the announcement again, is there a nurse or doctor on board the plane? Please make yourself known to the cabin crew. Now,
this is Nigeria.